watch this again later on. So again, welcome to Essential Leadership Skills in Long-Term Healthcare. I'm going to turn it over to Jenny Parker, who is a WGU alum, for her to go over some of those skills with us and share a little bit about American Senior Communities, which is where she's at now. So Jenny, I'm going to go ahead and turn it over to you.
Okay, thank you, Ezra. Yeah, I'm happy to be here. Thanks for having me. Yes, I'm very excited to be a WGU alum. I just completed my MBA just actually in February, and then I walked in March. So very excited to be here to share this information with you all. I definitely wanted to go over essential leadership skills because, that definitely coincides with my MBA, but also just what is really needed in long-term healthcare right now. So just want to kind of quick go over some things that'll be helpful for you to know. I'll kind of go over an agenda too of what all we'll cover. And then definitely if you have any questions, I'll make sure I'll have my contact information after this session. And then we can have a little Q&A as well. All right, thank you so much. Let's get started. So to kind of go over really quickly, like what I want to cover in this session is really I want to introduce you to a little bit about me, how I got started in long-term healthcare. I think it's an important journey to kind of see like how others kind of journey into long-term healthcare. It's not always really talked about as far as a career option when you're in high school or when you're in college or doing your advanced education. So I thought that'd be important to share with you, and then also what I do for the company. And then also I wanted to give you a little history of our company, just like what we do, what our mission and vision is, where we're based at, and then kind of go over, obviously, long-term healthcare. What are the career options there? What can you do in long-term healthcare to develop your career or hone in your skills? And then, of course, going through the crux of our session today is really essential leadership skills. What does it take to, be a great leader and be an effective leader, specifically for long-term healthcare, but it doesn't necessarily have to be. It can be in other terms as well. And then I'll kind of discuss with our company like opportunities for growth, and not just with our company, really with the long-term healthcare industry as a whole. What can you do as far as a leader? It's not all clinical, not necessarily. There's a lot of different opportunities, and so we can kind of discuss those. If hopefully it's a new introduction, if it's not, then chime in with your experience, of course, as well. And then I'll end off on kind of final takeaways to take from this session, and then we'll have our little Q&A. All right. So about me, my journey to long-term healthcare wasn't exactly linear. I had initially started in, weirdly enough, education when I was started in college. And what really brought me to long-term healthcare, and really what brings a lot of us into long-term healthcare, is a personal connection. And that's what it did for me. I started caring for my grandmother, was really interested in caring for her, really had the compassion to do that, and wanted to learn more. Like, what certain practices could I do to make sure I was caring for her the best way that she deserved and needed? So I did start my certification while I was still getting my undergraduate degree in certified nursing assistant, and worked in long-term care that way. So I actually started in direct patient care. Really enjoyed it, became a leader in it, and started training other CNAs on just kind of best practices, best caregiving practices. And then eventually did transition into staffing for a home health care company. So that kind of started my venture a little bit. It was kind of a more organic transition into recruitment, staffing, scheduling, and then training and development. So that's how I kind of got into human resources. So started in direct patient care and then kind of pivoted my way over there. Another thing that really interested me about long-term healthcare was I was really interested in mission-based work. I really wanted something, I wanted to take my education, my skills, and really put it towards something that I felt like I could make a real difference, make a real impact in the world. Um, and as I said, just kind of starting out doing that private caregiving really gave me that sense of the feeling that I'm really impacting somebody's life. And so it started with a family member, but then it kind of bridged off into other people that I wanted to care for. And so I really think that compassion and empathy really helps me in my human services role right now and just working in human resources because I can empathize with my caregivers, my CNAs, my nursing staff. So that's been really helpful. Um, Obviously, as I said, I graduated with my MBA at WGU, and the reason why I felt that was helpful for what I specifically do is it really increased my business knowledge. It really helped me understand more about employee culture, retention. It was a great way to really bridge the gap in some of my knowledge in consulting with my hiring managers, my executive directors at my communities, my DNSs, and just what we can do to kind of build our business brand. What can we do to make our employees happy? What can we do to really recruit fantastic talent? So that's kind of what brought me to WGU and really what brought me to long-term healthcare. So I'll tell you a little bit about what ASC does. American Senior Communities, we started in 2000, so we've been in business for about 24 years. We are based in Indiana, but we do have over 100 locations throughout Indiana. I specifically look for talent in our North Central, Northwest, and Northeast regions. Um, being that we have over 100 locations, we are the top provider of senior living care in the state. And really, we have a lot of great things to offer. We love developing our employees. We have a lot of programs that assist in this. So we've had many people at the entry level come into healthcare and not know anything. And then we provide them with CNA training. They go into qualified medication aid. And we've had certain nursing scholarships where they go on to get their LPN and their RN and even become some of our leaders. So it's really fantastic for anybody that who's kind of at the entry level, really fascinated in healthcare and are interested. Tell them to go apply for nurse aid and training with us, and we can definitely provide them that entry level experience and then develop their skills from there. Many of our communities have been blessed by just being awarded with certain different distinctions. And so I wanted to include that here. We've won national quality awards, quality assurance awards. We've been one of the top independent living providers by Elder Care Review. We were recognized in Newsweek as one of the top nursing homes, so that was really important. So yeah, just a little bit about us and what we do. Really, with long-term health care, with ASC as well, like we provide the full spectrum of care for our senior population. So we have anything from independent living to assisted living, long-term and short-term rehab, memory care, just really it all. As far as all that's encompassing, we do have a partnership with a hospice company as well. And our corporate home office is in the Indy area. So, but one of the things that brings us here really, and ASC is no exception, is there's a lot of different opportunities in long-term health care. As you can imagine, there's a big need. As I said, not necessarily always in clinical either. We have anything ranging from administration, social services, activities, culinary, nutrition. We have some great registered dietitians. But we have, our corporate home office support too that provides different services as far as IT, HR, sales, a lot of different opportunities. So why long-term healthcare? Well, I told you a little bit about my journey and how I got into long-term healthcare. And as I said, for a lot of people, it is a personal connection. They either were taking care of their parents or their grandparents or another family member and really felt called to keep providing that service. So that's one thing, is really a lot of people will come into it just like as they come into nursing as well, because they have a passion for mission-based work. They want to do something each day. They want to develop their skills and really provide a difference to either an individual or a group of people. Um, a lot of people too feel that our senior population provides a lot of knowledge and wisdom to them when they're hearing about their stories. It really just kind of gives them so much more knowledge within their daily life. Um, Obviously, another one too, where I spoke of that healthcare has so many different opportunities, is also just the overall demand of long-term healthcare. You know, we have a growing population of seniors and definitely have some needs from different family structures, where they need that care and they need all encompassing care. And so, as much as we've come from caring from our parents, and kind of going through those decisions, sometimes it does lead them to long term health care. So, a lot of people would choose long term health care for the fact of, you know, it's a big need, it's a big demand, and they have the job security knowing that it'll be needed for a long time. Another reason why people feel drawn to us in long-term healthcare is just the opportunity to kind of build on their skills. So, you know, there's a lot of things that you can teach, technical skills you can teach. Can't always teach compassion, but if people have the right compassion and they, you know, come to long-term healthcare for the right reasons, we can always provide that training and development where they can grow. And so, since we have such a big population of people needing care, a lot of different opportunities pop up and are developed, even, you know, with our communities. Sometimes they're just provided for at the time, that we feel like there's a need for this, you know. So it's a great time to join long-term healthcare because there's a lot of different opportunities and kind of different ways in which you can really use your skill set. Another reason people come into long-term healthcare, which kind of goes into mission-based work, is you provide a lot of support and compassion to people during a time that they really need it. You know, going through transitions is really hard, not just on residents, but their family members. And so providing that support to them is really life-changing. Um, Another reason why long-term healthcare is, you know, I talk to a lot of my nursing students, and when they're coming out of clinicals, they'll, you know, kind of consider long-term health care as opposed to acute care because they can maintain and develop those relationships that they may not have in another setting. So in a hospital setting, you know, you have patients come and go, and you don't always have the ability to develop those relationships and really connect with your people. So that's really important for them. That's honestly how I got into long-term health care as a CNA. Is I really wanted to see the same faces every day, and I really wanted to develop those connections and really feel like they were a part of my family. So people find that in long-term health care. Another reason is, you know, using different skill sets. I'll explore later on a lot of different leadership opportunities that are available in healthcare, and its ability to, you never really grow tired or bored of your job. There's so much to do, and there's so many different facets of long-term healthcare. You can go into clinical education, you can go into floor nurse, you can get into quality assurance. There's a lot of different things there to kind of work with. So if you're looking for something that can give you a little bit of variety, that's helpful too. And then, of course, you know, just becoming part of a really great care team. We really pride ourselves, and really long-term healthcare as a whole, in working together as a team, coming from different disciplines and really coming together for the same mission of caring for our residents and caring for their family members. So let's get into the crux of why we're here. What are some essential leadership skills and attributes that help in long-term healthcare? Well, when I talk to my nursing students, one thing that I will say is it really can be attributed to our kind of mission and vision at our company. So we call it CARE. And what we describe is really what's needed for people to be in long-term health care. So these, obviously starts with compassion. Compassion is a very big needed thing in long-term health care, no matter what your role is, from executive director to, housekeeping, maintenance, whatever you do in the community. Just really the acknowledgement that this is people's homes and, it's our workplaces, but it's their homes, and just making it comfortable and feeling, trying to feel how they would feel, really being empathetic to people's needs and what, they're experiencing at the time is really just an important thing to have as a leader. And you not only have that for your residents who you're caring for, but also your staff, and kind of understanding, how much duties they have, really what they've got going on in their lives. And that really leads to a lot of retention as well, is just being compassionate for others and understanding what side of the coin they're on. We're all part of a bigger piece of long-term health care, but we're all coming together for the same purpose of treating our residents with respect and dignity and making sure they feel cared for. Another essential thing that we talk about in our vision is accountability, is understanding expectations of a certain role, not only your role as a leader, but even in your employee's role, and then making sure that we can be responsible for it. So it's making sure you have that knowledge, making sure you understand the expectations, and then being held accountable when needed. Um, Another big part about our care system is relationships. So relationships is a big one in long-term health care. And naturally people would think, like, of course, because you're caring for residents and that's an important relationship. But really, when you think about it, in long-term health care, everybody has multiple stakeholders in this. So there's a lot of different people that we serve. So, especially as a leader, you're not only serving your residents and your resident family members, but also your staff, your employees, vendors that come through, third party, that really help in building the community, really any of your office support staff, referral partners. We have a lot of great relationships with local hospitals and different care systems. So that's important to build those relationships, because they come to you with those referrals because they trust you. And so part of that trust is really building those relationships, making sure that they're at the forefront of what you're doing each day. So there's a lot of people that you kind of have to cater to and have a servant heart with, because you're serving a lot of different multiple people, not just our residents, though they're of course the number one for us. And then our last one is excellence, which is a little hard to define as far as leader. Not everything's going to go excellent all the time, but it's just knowing that you're providing the best care you can with the resources you have available, and really expecting the same from your staff. A lot of things that we talk about too is leading by example. So also just showing like how you can, to the best of your ability, provide the care, and really making sure people feel accountable and that they're provided the resources needed to provide the most excellent care. And that's important for a leader as well. Not only making sure that you show them what excellent care looks like, but that you can provide them with the resources to do so. Another thing that is really important as far as essential leadership skills in long-term health care is flexibility. You could start your day, especially I know for our administrators, they feel this way. You could have certain plans in your day of, okay, I'm going to have this meeting at this time, but sometimes things happen. We have meetings with our hiring managers all the time, and they'll have to step out and say, I'm so sorry, a family member's here, or I'm so sorry, a resident really needs me right now. So being a leader, no matter what your position is in long-term health care, you have to have that flexibility, and just kind of I want to say like go with the flow, but kind of. Sometimes you can't always control everything in your calendar. Sometimes you have to give a little bit of that control to things that just pop up in the moment, and just being ready for that and knowing that that could be a possibility. Resilience is one. Things have really changed in long-term health care, and I imagine they'll continue to change as far as resources, and then just different knowledge gaps, how we can help clear those, how we can help train our staff and make sure that they feel protected and that they feel like they have the knowledge to do their best work. So resilience is a big one. Also, even, when we advocate for a lot of our residents with third parties, or when we're just talking with family members, just having that resilience and making sure that we can have an active listening ear, understand where they're coming from, and then just being able to kind of, find a solution for them. So a lot of different situations pop up, especially in social services with a lot of our social services directors, and they have to have resilience in their plans and then their care plans as well. Sometimes they try a solution and that doesn't work, so they have to pivot to another one. So that's really important too. As I said, with communication is a big one, and different, obviously stakeholders are involved in that. So being a great leader, you have to communicate with your staff, right? So everybody understands their expectations, not only with your staff, but then also residents. If a change has come up, letting them know and be active in their care. And then, active listening is a big one for our family members as well, just listening to their feedback and what they're needing. And, trying to find solutions to any problems they might be having. Part of being, a leader with our administrators at our communities is we have a really big staff. We have a lot of support. So you have your corporate home office support, and then you have your entire staff at the community level. And so another thing is being an avid team player and really seeing that team building is really important and working as a team. A lot of our communities have different departments. So we have social services, we have, MDS, we have culinary and our registered dietitians, and a lot of people coming from different disciplines. But we always make sure we get together for a huddle and just understand our goals and kind of what the plan is for today. And just also know that everybody leads knowing that we're all here for our residents, and we want the best quality of care from them, even if we come from different backgrounds. So it's that teamwork, understanding we're here for the same mission and vision, and also just collaborating together to make sure our residents are well cared for. Another really important part of being one of our administrators and executive directors is leading by example. So in our AIT program, many of our administrators will go through CNA training so that they understand the full capacities of the job and being in clinical, so that they're also able to pitch in when needed. And just as I said, leading by example, showing that quality of care, so that they don't feel disconnected from what their staff has to go through day in and day out, which I think is really important. Another important thing in long-term healthcare specifically is being customer service minded. Even in my role in HR, I have to be very customer service driven for a lot of my hiring managers. I have to understand that I'm here to serve them, and that I'm here to be an advocate for them, and I'm here for their support. So understanding that I'm here just providing the best assistance I can to them, listening to what their needs are, and making sure I provide those needs. And even if I can't provide them something, making sure that I'm able to find it for them. And so really, of course, what you think about with customer service is our residents are one, or family members are another, but even with each other and the support that we provide each of our staff members. They're a customer as well, and they're a stakeholder in this. We want to make sure we keep them happy and that we're able to serve them. Another thing that most people don't think about in leadership, especially when it comes to long-term healthcare, is just following trends and basing your education on those trends. So we're finding certain things in long-term healthcare that we didn't know in years past, like, just really understanding clinical education more, infection prevention, all these things, and really making sure that you not only hone your skills, but making sure that you're developing knowledge that attributes to the future, and how that's going to help you with healthcare in the future. So we provide a lot of that, of course, in any long-term healthcare setting that you find yourself in, they will as well. They'll provide certain CEUs or continuing education that's helpful, but then it's also good as a leader to just be abreast of all the things that are happening in long-term healthcare, how they're changing, and how you can change with it. Of course, another big thing that we talked about, which could be, coincide with accountability, is honesty and integrity. As somebody who is a leader in long-term healthcare, it's really important to, be honest with your staff, be honest with your family members and your residents, and really providing integrity behind your services. And this all goes back to, developing those relationships, making sure you have clear communications, and then just making sure that, you provide that reputation within your community, because as I said, that's how we receive referral partners, and how we're able to get those leads is because people trust us with, the quality. Another thing that is really, really important for anybody considering long-term health care is your commitment to high quality care. Long-term health care is, not necessarily for everybody. It is a hard job, but it's very, very rewarding. But you have to have the commitment each day that you're doing whatever it takes to make sure your resident feels loved for and cared for, that they're comfortable in their home, and that their family feels like they have that support too. So anybody who I know who's just a really superstar when it comes to either being a DNS at one of our communities or our ED is they really have that commitment to high quality care. They want it to be a place that people come into and they feel comfortable. They want their residents to feel safe and loved, and they really will do, everything that in their power to make sure that it's a great environment for them. And that means, making sure it's important to their staff as well, and making sure that they feel that they have the resources as far as training and development, that they can come to them when needed and provide that active listening. And that, you know, I I say it all the time with my administrators, when you make your staff feels that, they make their residents feel that. And so it really does trickle to what you show is important to you. The care is important, the compassion for your residents is important, and that really does trickle down to every person who works in our communities. So, along with leadership attributes and skills, I want to kind of go through two, just like opportunities that you could find yourself in long-term healthcare. The obvious is clinical, of course, nursing, RNs, LPNs. I did kind of put with each department, like what leadership positions would be attributed to those. And so there's really so many different things other than clinical. We have operations, support, we have nutrition and culinary, marketing and sales. We have people who are directors of sales and marketing, and so they work a lot with those referral partners I was talking about. Social work is a big one. We have social service assistants, but then we have social service directors as well. Activities and programming. administration, of course, not only with our home office, but then also just our executive directors. We provide that type of education where we train people who have their business degrees in an AIT program where they can learn to be an administrator at one of our communities. Human resources is an option too. That's what I do. And then therapy, of course. We have a lot of PTs, OTs. So a big division there. Information technology. We have an IT group, an IT support, along with our HRIS team as well. And then safety and compliance is another, just somebody who can kind of keep in tandem with our regulations, make sure that, we have accuracy in our records and that we're ready for any like long-term healthcare surveys that may come up. So what now? So I told Ezra would give you actionable steps to get started. So if you are interested in long-term healthcare, there's a lot of different ways to go. So one is we'll get started in the environment, just get familiar with it. And you can do this by an array of different ways. You can volunteer. A lot of people, myself included, actually, in long-term healthcare, before we started working in it, we volunteered there. We did, just activities, or, just kind of visited with the residents and really got a feel for what that environment's like. You can plan a visit. Really, along with volunteer, we're always accepting people who want to come in and just visit with our people and, maybe plan an activity with them. Or, sometimes we'll have kids come by and do community events. We'll have trick-or-treating during Halloween. We'll have different Christmas programs just going on. And so, and then another opportunity is to donate too. Some people just donate things that they feel like the residents would really like. That picture is actually illustrating a VR set that we had for our residents. So it's pretty neat to see them experience that and really enjoy that. And then, the obvious, like you could apply for an opportunity, and it doesn't necessarily have to be, in leadership right away. It can be just in activities, getting to know our residents, getting to know the environment, and just really understanding, like, is this the environment for me? Is this what I want to see day to day? So that's a really good opportunity to do that. Another option, if not quite ready to get there, is network with senior living professionals, or really just network in general. Just get yourself out there and find a mentor who's maybe, working in the long-term healthcare space, and talking with them. What made you decide to be in long-term healthcare? How did you get started? Why do you like it? What are some obstacles that you feel like long-term healthcare is going through? What are some challenges that you deal with? Just asking those questions, really connecting with them to see, like, if you feel like it's the right environment for you. Also, another option is, I know we have this at ASC, and so do a lot of other long-term healthcare companies, but attend open house, to attend one of our community events. We do educational lectures as well at our communities. So we've done dementia trainings, dementia lectures, just different healthcare topics. We've had open houses and just community events. We, as I said, we'll do a trunk and treat. We'll do different just seasonal events that are really fun at our communities, and people will come by and meet with our residents and kind of be involved in those in those events. And so that's just a way to really know the communities that are near you, and seeing if you feel like it's the right culture, if it's a right fit, if you feel really called to working in senior living and you really enjoy those residents, then it might be an opportunity for you. Also, another thing too, especially I tell my nursing students this all the time, request a tour, come on in, like, we're accessible. So they don't necessarily have to schedule, an on-site interview with me if they don't want to. Just come by and request a tour, ask for, the DNS to show you around and kind of talk a little bit about the community and what they're known for. We're more than happy to do that for them. And they usually love coming and seeing, okay, I could see myself here, or this seems like the type of environment I want to be a part of. And then when you do come in, if you do decide to do that tour or volunteer or apply for that job, communicate your intentions and goals with your hiring manager or whoever, you talk with in senior living. Like maybe just talk with them and say like, hey, like I'm really interested in this leadership opportunity. How would I go about it? Um, I really want to develop my skills in this one particular area. What do I need to do to get there? So there's a lot of different avenues to go. So just making sure that you connect with somebody locally and just asking them like, hey, what are some opportunities into which I can show that I'd be really interested in this role when it pops up because I really want to get into a leadership role. Right now, too, I'll just kind of walk into a little bit. If we don't have enough time, I can kind of end it. But I just wanted to kind of highlight specifically um, some leadership opportunities that we do have available, not just with our company, but a lot of different long-term healthcare companies do, just to give you kind of a sense of what kind of leadership opportunities are there. And then how you can either use that nursing degree or that business degree. And so I'll just kind of highlight a few right here. One is administrator in training. So if you have a business degree or a master's degree, bachelor's, you can decide, hey, I want to be an executive director. I want to run my own community. How do I get there? Well, really, as I said, if you have that bachelor's or master's degree, you can apply to be part of our AIT training. And so we provide that training on how to be an administrator. You know, are set up with one of our executive directors at our communities who are a preceptor and leader in what they do. And they love training other administrators. And so you really just, kind of shadow them and see what they deal with day to day. And they can train you in all the facets of running your own business. So it's going to be a lot of, finance and budgeting and some of those things that you've already learned in business. A lot of it's going to be people relations and how to build those relationships and sales and marketing and a lot of things that we've covered in our programs at WGU. So that's an opportunity too to say, hey, you know what? I have a business degree. I'm not sure what I want to do with it, but I'd really like to be a part of mission-based work. And I definitely want to be a leader. That's an ability to do that is just be part of our AIT program or even be, part of an AIT program near you because many long-term healthcare communities have them. And just, really acknowledging like, I really want to pave the way for long-term health care. I really want to be part of something that's a really big part of the healthcare landscape. And I really think I could motivate people to really provide great quality care for our residents. So if you're thinking that, that's definitely a job for you. Going more into clinical, a big thing for a lot of our people coming out of nursing, they've worked in long-term healthcare for a little bit and they kind of want to explore another facet. We have clinical education, which is great. We have, as I spoke earlier, we provide kind of our own CNA training for anybody who just at the very base level and entry level position is interested in healthcare and kind of wants to get their foot in the door. That's one way to do it. So our clinical education nurse will kind of spearhead that program of nurse aid and training. And so they, recruit for NAITs. They will, set them up with the training. They make sure that they do their classroom hours and their clinical hours, and then make sure they're set up to take their state exam. So once that they're certified, they can work with our residents, and they also see an immediate pay increase since they have that certification. Another thing our clinical education nurse does is they assess any knowledge gaps in some of our staff. So if they say, hey, they really need a, dementia training, like we're going to set them up with that. They implement those trainings in services and make sure that their, staff is all up to speed on the education that they need. They also assist in maintaining some of our records and just making sure, like with our surveys and our quality assurance processes, that they're up to date, it's accurate, and that we can provide the best quality of care. Another option is our MDS coordinator, which is a really big, important part of our team. And really any team in long-term health care, they assist not only with the resident needs, but making sure that, our resident care plans are accurate and up to date, that we have a fully developed plan of care, that they receive feedback from our staff to make sure that that care plan is up to date, and that it really assesses what all our residents need. They also provide a big assistance in quality assessments and making sure that we're, providing the regulations we need to for a lot of our compliance reviews. And they're just a big part of the leadership team and our staff too, because they really do assist, our DNS and our ADNS and daily functions of our clinical services, and really making sure we're providing the best quality of care. Another important leadership position that we have is medical records coordinator. So this is really somebody who makes sure that our medical records are enacted by Medicare, Medicaid, our other insurance providers, just making sure that we're up to date on those new regulations, making sure that we notify physicians and other healthcare vendors when orders are needing to be updated, or when residents need something, have new needs, or their visits are overdue. There's somebody who assists the entire care and medical team in ensuring that our records are up to date, accurate, and they really do help a lot with our long-term surveys and our assessments as well. And then, of course, just making sure that they compile the data, but also adhere to PPE, which is following our blood-borne pathogen standards, making sure that our staff has that type of training and they kind of stay up to date with that. Another role that we have that is similar to our CEN with a lot of onboarding as well, but is our infection preventionist. And this is somebody who will monitor our TBs and immunizations, screenings for all our residents, but our staff as well. A lot of our staffs will need to do PPEs and make sure that they're up to date on their health records as well. It's also somebody who audits adherence to our infection control practices, and make sure that the staff is up to date with that type of knowledge too. It's also somebody who's going to help the rest of our leadership team in long-term healthcare survey, making sure those records are up to date, and then just tracking any type of licensure, certifications, CPR certifications, any other CE used by our staff, and making sure they're really up to date, and really providing that guidance to them. Some people will have expiration dates, and our IP is really great at kind of working with our staff to make sure they keep up to date with the regulations and their certifications, which is really helpful. So what final takeaways can you take from this? Well, in considering a career in long-term healthcare, especially in leadership, I think the biggest thing is what we always say to people is consider your why. Why are you considering long-term healthcare? What is the big motivation for you to consider long-term healthcare? And do you feel like it's something driving you enough that you would feel like every day this is the place that you're supposed to be, and that you're willing to, have all the qualifications of just making sure that you're providing the best care for our residents? So just considering your why. My why was, initially my grandmother, just caring for her, and she's my why every day of why I'm in long-term health care. She's just kind of what makes sure that I feel even if I'm having a rough day, or it's been a hard Monday or something, that she's always what I go back to on why I want to make sure that everything I'm doing is really important, and that I'm a very small piece of a bigger puzzle of making sure like our residents are well cared for. And then I guess another thing is, consider is mission-based work important to you? Is it something that, you want, do you need to find, like I want to make a big impact each day with the skills that I have. If that's important to you, great, then long-term healthcare could be, something for you. That's a really big reason on why I went into long-term healthcare and just nonprofit work is I really just wanted a bigger mission behind what I was doing each day. Another thing is can you handle variety in your day? Can you handle, maybe, sprucing up your skills to fill another niche in healthcare? Is it important to you to have versatility in your skills and your development? Another thing, a part of long-term healthcare is just knowing that you're going to be part of a bigger interdisciplinary and care team. Do you want to work on a team? Are you good with teamwork and collaboration and communication? Is that something that, are those the type of skills that you want to hone in on? And then, of course, going back to your why and mission-based work, but also, do you just feel called to working with that particular population, the senior population? It's really interesting. We've had people who, have been in social work and maybe they've worked with kids and teens the entire time, but now they're really just feel called to work with seniors and they really want to help them through a lot of their transitions in healthcare and their living situations. So just knowing like, hey, do I see myself working with a senior population? No matter what you do in the community, it all comes down to those residents and their care that they're getting in the community. So even if you don't meet with them day to day, a lot of people on our staff will tell you that's probably the best part of your day. A lot of times I will either work for our corporate home office or work at home, but every time I go into that community and I get to talk to one of our residents, it's probably been the best day because they just know how to brighten your day and put a smile on your face. So if you feel called to that, it's definitely for you. And then, as I said, just honing and cultivating certain skills. We've had great leaders in nursing who, they'll be doing, records for a while, and then they'll be like, you know what, like I really could see myself really getting into clinical education and really understanding that piece of it. And just knowing there's different options out there for you. But it's really, as I said, with different quality assurances we have, with surveys, different regulations we have, just knowing and wanting to have that knowledge in, what changes in healthcare, where are trends setting, how can I kind of hone in some of my skills? And really, along with ASC and a lot of long-term healthcare companies, they will provide that education for you. We have it all the time where some of our staff will want to, get a certification in something specialized, and so we provide that education for them because it really does take wanting to know more than just what your standard skill set is. And then, as I said, too, just staying up to date with trends and data, kind of knowing, what the needs are of our residents, how that may be changing, and just really understanding the full spectrum of healthcare. Of course, physical care is important, but we're learning more and more. Mental, health is very important, and nutrition is very important, and just understanding the full spectrum of healthcare is really important. And how can we help our people not only physically but emotionally and mentally and socially and all those things, and just really understanding how our full care team really helps the person fully. You can't have one of those things without the other, and just kind of understanding that and understanding the data and understanding that how it can help you in your role. So those are just a few things to kind of consider in leadership, particularly with long-term healthcare. But of course, it's different attributes, of course, like compassion, accountability, relationships, excellence, those types of things. Really, you could take anywhere as far as wherever your journey may lead you. Um, and then I just wanted to kind of end off with to give you guys some time maybe to ask questions, but just like ways to connect with us. If you are interested, we have some great employee testimonials, but we have some fantastic resident stories on there too. We always celebrate 100 birthdays and more. And so that's really fun to see those residents celebrating that. So we are on LinkedIn, Facebook, Instagram, and then, of course, our website as well. And then I just wanted to thank you for your time. And then if you have any more information just on long-term healthcare, opportunities in general, you can reach out to me, but then also, specifically for ASC, if you just need a mentor or just somebody to kind of talk through things with, I'm more than happy to provide as well. And that's all my information there.
Awesome. Fantastic. Thank you so much, Jenny. Really appreciate you and all of the information that you've shared. Um, I know Brittany had a question, I think when you were talking about some of those actionable steps. So
Yeah.
I'll kind of pick on you, Brittany, first in the chat here. And then if anyone else has any other questions, feel free to add them in either to the chat or unmute yourself and ask. Her question is, I have thought about going into a LTCF and asking to talk to an administrator. Would that be better? Would that be a better idea than cold calling?
Yeah, absolutely. I think so. I personally would probably prefer a visit over a cold call. Really, like, they're so busy day to day with different requests. As I said, through a lot of different parties. So I think if you come by and just say, "Hey, I'm really interested," and especially if you're interested in administration too, Brittany. But yeah, I think it would be great to come by and just share with them, hey, I'm really interested in long-term healthcare. This is what I'm considering as far as a career choice. I'd even ask them for advice on how to get started locally, but then yeah, just ask for a tour and say, hey, can you just kind of like walk me around and let me know different opportunities that you have available here. But yeah, I think it would be much better to just kind of come in person and introduce yourself.
Fantastic. All right. And then another question here. What are some of the things you wish you knew when you started in your career?
Oh, that's a great question. I mean, I will definitely attribute this to long-term healthcare, but let me know if you just want me to expand on it. But I think, a lot of what I wish I was told was, well, first of all, when I started my education, I was really young. I didn't explore long-term healthcare until, a few years later, when I finished my college education, and that's when I got my CNA. And I think, one of the things that long-term healthcare specifically, that I wasn't told, that I think some people aren't told, is it can be really hard. It can be really hard because you develop these relationships, and they're really important relationships, and they do become like family. And a lot with long-term health care is, for not all, but some of our residents, we are there for the later stages of their life. And so that can be really hard to navigate. And as I said, I was pretty young going through that. And it's hard, especially since I don't think I had a lot of um, real like experiences in death and dying and that type of thing. So I think that's really hard to navigate that. Um, but at the end of the day, it did become like so much more of like, okay, that's why you look back to the mission of, well, the mission is like really care for these people, and I really want to continue to love them and build that relationship. But it does become really hard when they have to go on hospice and then you care for them at the later stages. So I think that part's really hard. That's hard for anybody. No nurses for, you know, people who've been doing it for 30, 40, 50 years, much longer than me. And it always remains hard. But I think they just go back to the reward of it and how they've impacted that person's life. So that part's big. But with something a little less dramatic, I think of what another kind of thing I wish I was told is really, and I think WGU is good at this, but I don't feel like I was ever told this when I was doing my undergraduate work, is like, really don't be afraid to get yourself out there and network and learn about the community around you. It took me a while, and I'm just naturally an introverted person. But it took me a while to really start making connections in my community, volunteering, and just make sure that that's important too. I wasn't joking. And I will say this to anybody, no matter what journey you're starting in your career. Connecting with others is important. Having a mentor is so important. I wish somebody had told me how important that is at the beginning of my career, as opposed to me, eventually finding out in the middle. But yeah, so those are a couple of things that I really wish somebody had told me earlier. But yeah, let me know if you want me to add anything else. But those are probably my two main ones.
No, that's fantastic. Um, Kind of going off of that, another question here is, are there
Yeah.
any good questions you recommend asking when determining whether you want to apply to a specific facility?
Yeah, that's a really good question. It depends on the role, certainly. So, whether you're in clinical or social services or what have you, or business, like, that'll depend a lot of it. But just good general questions I would ask is, how long has your leadership staff been here? Why do they like being here? Um, how many, what's your occupancy with your building? For a lot of my people who are just starting out, they feel a little less overwhelmed if they're in a smaller community or a smaller campus. Now, maybe, a larger campus that has like, 200 and some beds, that might be a little overwhelming. So maybe asking too, like how many residents can you house, and also like what their census is too. That's an important question, because not everybody is at 100% census all the time. So just asking like how big their community is. Longevity of their leadership staff is important. Um, I'd ask about culture. Culture is a big one in a community. As I said earlier, we have over 100 locations, but my communities that I go into, all of them have really different cultures and really different, vibes to them. So maybe asking about that. And then not only asking them, but even just asking around in the community what the reputation is, what's the feedback on that community. Um, and then, yeah, but I mean, those would be the major things I would ask. Also, depending on, as I said, it also kind of depends on what job you're going for. But if you're in clinical, a big question to ask too is maybe like patient ratio, like what you're looking at there. If you're a nurse or a CNA or a QMA, maybe just asking like, hey, what would my, patient ratio would be? How many people would I be caring for? Different care levels and stuff like that. Those would be good questions.
Good, fantastic. Well, we are at time, so I want to be mindful and respectful of everyone's time. So thank you everyone for coming. I'm going to hit